All right, welcome everyone. My name is Izzy Greenberg and I work with Childcare for CT, and this is a special series that we are running on the economic impact of childcare. We recognize that there is still a lack of understanding of the true impact of childcare on the economy as a whole, specifically on Connecticut's economy. And so over the next month, we're going to be running a series of discussions to help you understand the true cost of care, the economic impact of childcare. And so we are very, very pleased this morning to kick that series off. Before we get started, I would just like to do a few thank yous. First, to Sandra Cardone for providing interpretation today so that we can open these up to a whole lot more people. And especially to Mindy Gold, who helped us to set this specific session up. So we very much appreciate that. Really excited today to have Kathryn Anne Edwards here with us. She is a PhD economist, an independent economic policy consultant, and her research focuses on the intersection of labor markets and public policy. So excited to have you, Kathryn, and welcome. We'll just turn it right over to you.
Thank you all so much for inviting me. I'm very excited to be, here on the Zoom talking to all of y'all. The way that economists view the world is different than the way that people experience it. We sometimes take, we move up to the 10,000 feet and we'll look at an entire system. And for many of you, whether or not you're a parent or a provider or an advocate, you live on the ground. And what I wanted to take this opportunity to do was to show you how economists think about the child care system in the United States, and this applies to Connecticut. Now, that doesn't mean, I do realize that no one's like, great, economics at 9 a.m. on a Tuesday, what I've been dreaming for. I am going to make this, as accessible as possible. And my goal is to give y'all the tools to talk about the economics of childcare without having some economist telling you that maybe you don't understand. And so I want you to be able to talk about this and empower yourself to have the type of language that we use. So with that, I will get started. I've made some slides for y'all to follow along. And, as Izzy said, my name is Kathryn Anne Edwards. I'm a labor economist. I'm an independent policy consultant. That just means I run my own business. And we're going to talk about the economics of childcare. Now, the most succinct way to describe the economics of childcare is that it's a market failure. Now, that's nothing to say about the people who provide care. The market, as economists would see it, is that we currently sell the care of children under 5 in the United States. This is the market for childcare. That market is a failure for 2 reasons. One, there is not enough care supplied by the market. And I'm sure y'all could tell me better why this is the case. Things like it's too expensive to open up a center. I can barely pay my workers as it is, and I have a hard time recruiting to expand the number of spots. We say this is a market failure because there are more parents that want care for children than there are spots. That's a market failure. The second reason why the private provision, and this is what I call, quote unquote, the private provision of childcare, which is just non-public childcare, which is what most providers are. Even if they're nonprofit, it's still considered a private provider. So Head Start wouldn't be in this space, but most providers would be. The second reason why this private provision is a market failure is because the market clearing price, aka what you charge for care, is above what families can afford or really easily afford. So parents are either entirely priced out of the private market or they pay market rates but with a burden. So these 2 things make childcare a market failure, almost. 1, there's not enough, and 2, it's too expensive. And those are things that we all understand readily. I don't need to prove to you why there's not enough childcare or it's too expensive, but these are hallmark traits of a market failure. Now, there are lots of things in our economy, goods and services, that would meet the definition of 1, insufficiently supplied, or too expensive, right? There's lots of stuff that we don't have enough of that people want but can't afford. So examples that I give would be, Maine lobster. We don't all get to have Maine lobster every night for dinner. It's too expensive and there's not enough of it, right? We don't all get to go to Taylor Swift concerts. Some of us do if we're willing to pay the exorbitant prices for it, but we don't all get to go. Oceanfront property is another example, or I threw in here in case there's any fashionistas on the call, a Birkin bag. Now, these are things that are just, they're very expensive, they're very limited in supply, and that makes them an expensive good. But they're not a market failure because what makes a market failure truly a market failure, in addition to, that there's not enough of it and it's expensive, is that because there's not enough of it and expensive, that has really bad effects on the economy. So what I put here is that there are deleterious effects on the economy from being scarce and expensive. Like I don't get to go to a Taylor Swift concert because it was too expensive. Totally fine, right? The economy doesn't blink. It doesn't matter that I didn't get to go to a Taylor Swift concert or that I don't own oceanfront property or have a Birkin bag or eat Maine lobster whenever I feel like it. That doesn't cause some like big negative effect on the economy. There's no spillover that hurts all of us since I can't have Taylor Swift concert tickets, right? You are not affected by me not going to Taylor Swift. You are not affected by me not owning an oceanfront house. Childcare is different. You are affected if I can't afford childcare. You're affected because me not affording childcare and parents not affording childcare brings down the entire economy. This is why we call it a market failure. There's too much, there's not enough of it. It's way too expensive. And since not everyone who needs childcare can get childcare, that hurts the economy. So what's nice about thinking about childcare from this framework of the market has failed is that the consequences really give you a sense of what childcare investment from the public sector can generate for an economy. So I'm going to talk about the bad, and then also the kind of the inverse would be the good that was come from intervention. So right now in the childcare market, some parents pay for care. Some parents stay at home and provide care themselves, and other parents opt for informal care in quasi-paid or unpaid settings. And a lot of the evidence we have about informal care is that it's used in conjunction with other care. Like I put my kid in a child care, but I can't make it for pickup, and so someone picks them up after school, like a friend or family or a neighbor. So the first problem with this market failure is that if you pay for care, this greatly affects your family budget, right? If you're paying through the teeth for childcare, there's a lot of things that you're not spending that money on. So I give an example of there's a family paying $2,000 per month per kid. They'll spend $24,000 a year on childcare. So depending on how many years of care they seek, say 3 to 5, they could be spending $74,000 to $120,000 total on just the preschool care of one kid. You have two kids, you're kissing $250,000 spent on childcare right when the parents are in their prime earnings years, right? That commitment of spending to childcare takes dollars out of the economy for other spending, right? As well as limiting what kind of apartment or house you could rent, what kind of a house or condo you can buy, or your ability to save for retirement. It's a lot of money to put into one place that could have more beneficial effects on the economy overall. So this BOTE is econ speak for back of the envelope. So say there's 200,000 kids under 6 in Connecticut, and assume half of them are in a paid care situation, paying $2,000 a month. That's the equivalent of $2.4 billion that's not flowing to the rest of the Connecticut economy through food purchases, through travel, through shopping, through rent or housing. That money's going to childcare. So we think and have really good evidence actually from Germany that if you expand childcare and you basically take the burden of paying for care off of family budgets and into taxpayer budgets, one of the first effects you see is that money goes out the door for other things. So a consequence of the market failure is constricted family budgets. A benefit of addressing the market failure is people have more money to spend, and this helps economies. Kind of a point to add here, the cost of childcare absolutely affects fertility decisions. And because we have basically put a front-loaded tax on having children, if you want to keep working or have care, not having access to affordable care affects the ability for people to have the number of children they want. One survey that I think showed this really well was in the New York Times a few years ago, where they asked people who had a kid, why aren't you having another kid? And they could write in whatever they wanted. And 64% on an open write-in said the cost of childcare. This mirrors what the evidence base has shown from the expansion of childcare in either localities or states in the US or in other countries, which is that childcare is the single most effective policy for increasing fertility. So if you just wanted to have more children, and you only cared about fertility, which has weirdly come up lately in policy circles, the most effective policy is childcare. Like that's where you would have to start because it has the most evidence of increasing the number of kids. I don't like to think about it that way. I just think about the cost to our social fabric that there are people who don't get to meet their family goals because of childcare. That because of the cost of having a kid, which childcare is the largest ticket item before you hit school age, but it's not by any means the only ticket item, but because of money, you don't get to have a family or the family that you want in the US. I think there's a cruelty to that we should address, but if you didn't care about how people felt and you just wanted more babies, you would also want childcare. So this is the consequence of the economic consequences of childcare being so expensive. And then, of course, what the economic gains would be from intervening. The second consequence of childcare being so expensive is that it limits the labor force participation of parents. So consequence one was, listen, I know it's expensive, but I'm going to pay for childcare anyway. That has all kinds of problems. This consequence is because it's so expensive, I'm just not going to work while my kids are young. And that there's lots of things that go into that decision, but we have really good evidence that the more expensive childcare is in a locality, the lower the net work rates of moms. So yes, this is a decision about your family and your preferences and whether or not you want to stay home, and all of that is true. But it is also true that if I have childcare in two markets and one costs $1,000 more, there'll be more women working in the place with cheaper childcare. So this has massive consequences for the economy as well. So the best way that I can sum up the research and evidence base about this is that any move where you put children somewhere free and safe between the hours of 8:30 and 5:30, it will increase the number of mothers working and their income. There was an example that came out recently from Connecticut, from the New Haven Universal Pre-K program, that was associated with a 21% increase in earnings for 7 years, which comes out to about $5,000 to $6,000 a year. The mechanics of this are multifaceted in terms of the labor market. And of course, since I'm a labor economist, this is where I geek out the most. But basically, it affects your ability, not just hours that you can be at work, but the type of job you can take, the type of commitment you can make to work, and how that cascades over time. So, another way to put this consequence in context would be to say, keep in mind that what's at stake for the economy is not just the 5 years that you decide to stay home. It's also the next 35 years that you could be working if you don't go back. So it's a massive risk in terms of the number of workers, the income of families, and of course, tax receipts from state legislatures, that you have basically this wedge that shoves people out of the labor market, and they could be gone for 1 year, they could be gone for 5 years, they could be gone for 35 years. So it's a lot for the economy to lose if you only view people as like little worker bots. I don't want to minimize people into being just little worker bots, But the size of the economy is very well predicted by the number of people working in it. You lose people, you lose economic potential. You add people to the economy, you add economic potential. We're entering a new era in the United States in which we do not have kind of boundless population growth that we've seen in prior generations. We have had, kind of smaller cohorts of children since about 2007, 2008. And our economy is feeling the effects of that even at older ages because we're starting to see labor market shortages and labor market pressure from not having enough workers. And a lot of businesses have said that they have a really hard time hiring. This has put pressure on a lot of state legislatures to try and walk back child labor laws because they're desperate for anybody who can fill a role. I said in terms of the first consequence that if you wanted to increase the number of children born, you would pursue childcare. That's also true about workers. If you wanted to increase the number of workers in the economy, childcare would be the most effective way to do it because it affects a really large group of people, mainly moms, and it affects their ability to work that can have dividends for, the next 30 years. Um, so in terms of economic impacts, y'all, this is unrivaled to both increase the number of people in the economy, increase spending in the economy, and increase workers in the economy, this is the best investment we don't make. Just because of the just cascading dividends that y'all would get or an economy would get from investing in childcare. And we can see it from all of the costs of not having accessible and affordable childcare. The other thing I would point out in terms, this is just to, kind of, so you remember, women and men don't hold the same jobs, which means moms and dads don't hold the same jobs. So if you have a kind of wedge that shoves a lot of women out of working, keep in mind that the top two occupations for moms, both in terms of the just sheer number of moms who work in them and the share of total workers who are moms, it's nurses and teachers. Two occupations that have been feeling the effects of labor shortages for about 10 years. We are having a hard time in our economy having sufficient numbers of nurses or teachers. And we happen to know that a lot of them are moms and they could be paying $120,000 for childcare. Like this is a very clear like problem solution, or the way that I think about it is that this is a risk, a needless risk in our economy, that we are adding a risk to sufficient number of nurses and teachers, two highly critical occupations. Uh, the other way to think about it in terms of the risk that this introduces to the economy is that workers with non-standard hours or who have standard shifts that aren't 9 to 5 can have some of the biggest challenges in finding stable childcare, right? You have daycare centers that are open 8:30 to 5:30 or 7:30 to 5:30, maybe 8 to 6, but you've got police officers, EMTs, firefighters, hospital workers, and they all work 7 to 7. And finding childcare to meet your shift, I mean, that's a hustle because maybe you can find a center or home-based care to meet the first part of your shift, and then someone else, like a friend or a family member or a partner, can meet the second part of the shift. But it puts you in a really tenuous situation for knowing that your kid is safe while you are at work. So the city of San Diego just built a massive childcare center and attached it to one of their police departments. And the childcare is for their public safety officers. And the childcare is designed around their shifts in order to keep stable, basically, work rates and shift staffing for a group of people that are very important, but are constricted by the realities of a childcare market. So when you think beyond the market for childcare and what public intervention can do, you can think about tailoring childcare to the needs of workers as opposed to workers tailoring their lives to meet the market for childcare. And the economic potential, it's all on meeting workers where they are. Okay, so one more consequence slash benefit is quality. This is a sensitive subject because we don't like to talk about how quality varies across providers, but Mother's education and income predicts the quality of early childhood education. Full stop. So there's always this kind of latent debate over what is best for children. Should they be in a center? Should they be in a home? Does it vary by age? Should they be in home? Should they be in home with a nanny? In home with a friend or family member? That is a distraction from the reality that wherever rich children are, they will get the best care. And their moms with high education and high income are able to guarantee it. And the type of care doesn't matter to quality if you have high income. Now that's rather a devastating prospect because this basically imprints economic inequality on the divide between rich and poor. It's imprinted on children by the time they show up to kindergarten. They're 5 years old, and I can look at their kindergarten readiness and tell you whether or not they had a rich parent. That is a failure of early childhood education that has long-term market consequences. I mean, for one thing, it makes the task of public school a lot harder. And I'm sure any K through 12 teacher will tell you that it's not easy to make up from a starting deficit in a year or 5 years. This puts a lot of pressure on the K through 12 system. It also tilts the advantage from children basically to what their parents' income make. I mean, there's so many ways our economy does that, but we have a way to intervene in which we're currently not intervening. So to the extent that inequality between children matters to you, I can tell you that it matters to the economy. I can tell you it's not great, that you're more likely to do worse on the SAT if you came out from a low-income family with low participation in high-quality early childhood. Well, that's not great. But children aren't able to shake off economic disadvantage. Not the way that we would say you should pull yourself up by the bootstraps. I mean, that's just a lot to put on a 5-year-old. And and frankly, they don't do that well at it. They kind of take all of this disadvantage with them. Childcare isn't a cure, but it's a relief to have standardized quality care that everybody can get and not just children of rich families whose moms are able to command the resources and power to make sure their kids get the best. If you make the best something elusive, rich children will get it. If you make the best something that is a minimum for all children, you're tilting the scale. This won't solve economic inequality by any means. It'll just help shield children from it at very young ages. What kind of effect that will have in our economy is hard to say because we've never done it before. But I think that this one is maybe the most elusive in terms of putting numbers to in economic terms, but we know that it's there on the negative side. We don't have a sense of what the benefits would be should we change how we deliver childcare, right? Like we make childcare free, I can tell you like lots of numbers of what it would do for people's budgets and savings and house and so on. You make childcare free, I can like come up with a little prediction of how many more babies would be born and how many more women would be working. But you make childcare free, the effect on inequality and academic achievement between kids from high and low income households, we don't know how large the effect would be because this one is not something you can predict on the margin, but it's important. So the last thing I'll point out is that the kind of final marker of market failure in the childcare system is that the market will never improve. It can only deteriorate further. There is no innovation in delivery, in organization, in artificial intelligence, in supply chains. Nothing will change the bottom line of the childcare market. It will only get more expensive and less available. Little children need the eyes, ears, hands, and attention of a capable adult. The market can't change it. It can only make it more expensive, right? There's no miracle coming that will suddenly make childcare plentiful or affordable outside of public tax dollar intervention. That's the only cure that's coming. So, and I always, when I put this to legislators and lawmakers, which I've talked about in many states in the US, I just tell them, you know the solution. It's just a question of how long you want to wait to get there, because it is the only solution that exists. Now, I think there has been move in a lot of places to deregulate care, to offer lower quality, to change the staffing ratios or the age of people who are staffing with children. And I mean, all I would say about that is kind of going back to what we know about the type of care that rich families are able to get, you know, should you want to make childcare less regulated, you are basically kind of opening up lower quality care for low income children, right? Rich parents won't send their children there. You're just saying that lower income children deserve lower quality care, and you'll have the same problem, I would say, within one legislative session or two, is that childcare is only going to get more expensive. The price of childcare has risen faster than the price of food, housing, medical care, even prescription drugs over the past 30 years. It clocks in at 6 to 7% average growth in a year, or in year-over-year prices in the cost of childcare. So, you know, sure, you can bring down the quality of the market, but even that is not going to do nothing to stem the tide of the upward pressure on childcare prices. So you're basically trading quality for low income children for possibly 2 to 4 years before you find yourself in the exact same spot. And so I think I kind of go back to what I've said before, which is we know what the solution is. It's just a question of how long you want to wait to get there and how much, frankly, damage you want to do to the economy in the interim. And since we haven't had childcare for the decades past when we've needed it, I'd say we've done enough damage. And it's time to help families with this really critical cost, really critical service, and really critical need for children. And that is all I prepared.
That is plenty. Thank you so much. It's wonderful. So the purpose of this series, really, when we kind of step back, is to help lawmakers in Connecticut make the best choices. And I love what you said. You know the solution. You just have to decide how long it's going to take you to get there. I mean, that is certainly how a lot of folks who are in the early childhood world see it. We do have a number of lawmakers here this morning, and I'm, really grateful that you all have taken the time out to learn about this. And as we promised to lawmakers, because this is it's always a difficult time of day at this time of session, but we are going to be sending the recording out to everyone after the fact. So if you're here, or if you are here as a non-lawmaker and want to sort of remind your lawmakers to watch, we will be sending this to all of them along with the recording and all of the slides and links and everything else. So that will be coming. Our coalition understands the impact on the workforce, on families, on the economy, and it's why really we're pushing for transformative change, no more nibbling around the margins. And there's a number of early childhood bills that are out there this year. It feels like this incredible, we have this incredible bounty that now, they're not all going to pass. We're in this process of consolidation now. And I guess the reason that we wanted to have this was so that our lawmakers could make the best decisions as they choose how to consolidate those to make the biggest impact on families and on our state as a whole. So just kind of want to set that framing a little bit as well as we now begin to go into the Q&A part. So I know there's probably a lot of questions out there. Folks are welcome to put them into the Q&A. Please don't put them in the chat. And then we have some as a team. So Ava, I'm going to start it off with you. Ava Bermuda Zimmerman, Coalition Director. You have the floor.
Thank you, Kathryn Anne, for being here.
Wait, I am not hearing you.
Is that better?
Yes, it is.
I was in Spanish. I do like listening to.
Yeah, actually, you're muted again.
That means Kathryn Anne is not in English.
Okay. If you could choose, click actually, why don't you just go to original, Ava?
It's not letting me do original. It's only.
Okay. Can you click the globe at the bottom, Kathryn, or interpretation, and choose English? And it's not letting you, Ava?
Okay.
So
there you are. There you are. Oh, it was my fault. I'm so sorry, Ava.
No worries. Not at all. Listen, this technology is a miracle. The fact that we can be doing this in 2 languages at once is incredible, and any little glitches we have are well worth the sacrifice. So Ava, turning it over to you again.
Glad you guys can hear me. So I just wanted to start off, obviously, to say thank you for being here, Kathryn Anne. We're overjoyed to have such an national expert on the topic. And the connectivity between childcare and the economy and how one doesn't thrive if the other doesn't thrive, right? It's symbiotic. So my first question for you is, are there examples out there, maybe in the United States right now or in other nations, where childcare being a priority does help the economy? Are there examples in our history or examples that you can give that shows that this is possible success in the economy and childcare, and that symbiosis could be carried forward into something, good?
Yeah, historically, the US on the federal level, there's a great example from the Lanham Act, which is Lanham. The Lanham Act was passed in World War II, and it was easiest way to describe it is a bunch of money to help support wartime production. And one of the uses of that money was to build childcare at wartime production facilities so that women could work in the factories. And in some ways, it's a great and simple illustration of how childcare increases work and that we've known it for, 70 plus years, right? You wanted women to work in factories because so many men were serving overseas, but they couldn't work because they didn't have a safe place to put their children. This became scandalous at the time of kids that were like wandering around the streets during the day while their moms were at shifts. And so in order to stabilize employment and make sure women could work in the factories, they set up childcare centers and they set up hundreds across the United States. They did it really quickly. The places were high quality, parents loved them. And after the war, there were protests across the US, begging Congress not to cut off these funds, but to keep childcare in place. And of course, they cut them off pretty quickly after the war. A handful of states tried to continue the funding on their own, but within a few years, they had cut them off as well in this great federal experiment that basically proved childcare supports work and family income was all scaled back. And by 1950, it was as if it had never existed. The second example of federal childcare comes from the military. Same problem, different setting. In the early 80s, there were all kinds of kind of reporting coming out of military bases of like men showing up to like an early call and their kids are like in pajamas sleeping on the side of the field because they couldn't leave their kid at home alone. And it became a constant problem that people didn't have a safe place to put their children when they had this like non-standard hours, non-standard work calls, and they needed to have better childcare on basis. So the federal government created a very high quality childcare system for actively serving members of the military. It took them a while to get it right. There was lots of improvements along the way, but on average, military childcare is better than anything any of us could buy. It's incredibly high quality. So the federal government has, on two occasions, shown it can absolutely ramp up a great childcare system. And it supports work, it supports non-standard workers, it's important for families, it's important for keeping people in the military. So they know all the benefits, they just don't give it to the rest of us right now. On the state and local level, there's been incredible progress, really starting about 20 years ago, kicked off in earnest of localities taking the lead on providing childcare. And so you'll have things like the San Diego Center that's around, emergency and responders and public safety officers. New Mexico has just added to their constitution that they will have universal childcare. Of course, unlike a lot of states, New Mexico has a permanent fund for mineral deposit rights. So they have some money to throw around that a lot of states don't. Lots of cities have been moving, like the city of Denver. Colorado is trying to expand as well. And all of them have accrued their own evidence of how important this is. Two cases I would bring up in addition is that the District of Columbia added pre-3 and pre-4 as a by right, universal access, completely free, any income level to their public school system. So every kid in DC, if they are 3 years old on the day school starts, can get 2 years of free preschool. And at the same time, that made the 0 to 3 market very expensive. So they set up what's called the Pay Equity Fund, which is the district supplements the DC child care workers pay to the tune of almost $14,000 a year. And it has done wonders for retention, for the pride of workers, for their ability to have reduced tenure, and to expand the number of child care spots in the district. The second example I'll give is that the pandemic, showered money onto the childcare system because it was in an absolute crisis. And several states have been trying to maintain the money after the funds cut off. One state that's doing that is Massachusetts. Massachusetts is, okay, I think I might be stepping into like state rival territory of Connecticut and Massachusetts. I don't know how y'all feel about them, if they're like considered a rival, but
We love anyone who's making this work.
we love anyone who's making this work. They have done really kind of incredible amount of work to maintain basically the grants to child care centers in order to keep them open, keep spots open, and keep costs down. And so, my understanding of the Massachusetts system is that they're like, okay, here's a check. You run a licensed child care center, here's a check. Don't shut off the lights, keep spots open, pay your workers, and you can spend the money how you need to. And they're subsidizing the supply in Massachusetts. And I mean, states and localities use whatever they can. Like the city of Houston basically exempt all of their child care centers from property taxes. So people have levers and they're using them. But yeah, the evidence coming from all of them is like, this was also great. Here's another thing that's great. It's a big win.
One thing that we have thought about is you talked a little bit about how women also how their jobs are different. We really see this as a gender equity issue, but it's funny that we both have always seen sort of babysitting as women's work, and so we've got a problem on the workforce where this is primarily women, and there's a lot of inequity within the workforce. The childcare workforce. And then we've got the side of the sort of whole state's workforce where families are making choices about which shift people take, the difficulties of just running a home. Does one parent not work? So we've got all of those problems. We've seen some examples where places that have done some work on this. I think Quebec is a good example, where it has shown an increase in women's participation in the workforce. I'm curious if either from any of the states you mentioned, actually the military, what happens in terms of two people who both, let's say, assuming want to work, what have we seen as the kind of, I don't want to say side benefits because that's a primary benefit, but you fix childcare, someone can go to work. Does it make it so that people can, is there any evidence rather that people can take more promotions, that they can stay in a home, that they can go back to school, that they can, like I'm curious about mobility. I guess that's really what I'm asking. Curious about mobility and the kind of ripple effect that it has when you actually solve the problem.
Yeah, there's evidence in both directions. So fortunately, one of the better pieces of evidence is from Germany, which is like, oh, who cares? It's
totally
Germany.
Different system.
Totally
right?
different. But what they found in Germany, it's because they have different data than we do. But what they found in Germany is that women would turn down promotions or job switches in order to not change their childcare routine. Right. So you're so committed to pick up and drop off that if a job kind of could interfere, even if it pays more, you would basically constrict your own labor market success. And that's in a system, I mean, keep in mind, that's in a system that is highly generous, near free, and highly subsidized with very high quality. They will turn down jobs to make sure that they don't disrupt their childcare pickup and drop off routine. So that's evidence in one direction. The evidence in the other direction, I think one of my favorite studies is from universal pre-K in New Haven. It's rationed. It's not enough for everybody. So if you look at who gets it versus who doesn't and compare their earnings, you can see that the effect of universal pre-K has positive earnings effects for 6 years after pre-K. And that comes from the mechanisms you're talking about. I mean, we don't see people's promotions. We don't see if they took a job, if they like got more responsibility at work or started traveling at work. We just see that their earnings are going up for years after they have stable childcare. And what's remarkable about that is actually really the universal pre-K study in New Haven, very similar to studies of the expansion of kindergarten in the United States. I mean, keep in mind, public school used to be 1 to 12. We expanded to kindergarten, and it was a very slow rollout, went state by state. And if you look at the state by state expansion of kindergarten, of what of half day and full day and so on, you see the exact, like very mirrored effects of, moms start to earn more money. That effect can last for multiple years, and it's because of these mechanisms on the job that allows you just to commit to a job.
Yeah. And so one thing that I've seen tracked is, the amount of debt, let's say a family has, but I haven't seen a lot about where that debt originates. We know certainly where student debt originates, but I have the sense anecdotally that when people are in the preschool years, in the early childhood years, that is a time when some debt originates, and that sticks with you for a long time, especially if you have passed up some promotions or had one person not able to work as much. And I'm curious if there is any linkages between a successful system and family debt. I haven't seen a lot of studies on that, which is taking.
You can't make international comparisons here because we don't have the same debt structuring process. And international comparisons is where we have the biggest move for like the boldest childcare moves. What I will say is that care.com does pretty regular surveys of parents, like how they're able to afford care, and they have survey evidence where people report we have taken on debt in order to pay for childcare. The reason why we don't have great understanding of this is that it doesn't show up in a credit report. So like if I pull someone's credit file and I want to know what is the effect of debt on, say, asset accumulation, I can see the debt lines they have, and I can see I can see a student loan. And then I can compare people's mortgages, right? Another debt line that comes through on your credit report. But I don't see childcare because it's an out-of-pocket spending. And so I don't have a great way of understanding how childcare relates to debt, because it is very hard to identify in public surveys who is paying for childcare. So it's the kind of, we know the global consequences are bad, but studying it on a family level on the negative side can be really tough because we don't ask in public surveys, are you sending your kid to care? How much are you paying for that care? And so we can't do a lot of outcome comparisons of, say, like a classic labor market study. But if I know you live in a locality that just got free care and you've got a 4-year-old, then I can see what happened to you. So we don't have great debt studies. And this is one reason why labor market participation is one of the most studied outcomes. It's the easiest to see in data, but it is by no means the extent of how families would benefit.
Yeah. Okay. We've got a question from Linda. She says, great presentation, completely makes sense. What do you see as the pushback to this, and why is it so hard to make these points legislatively?
Okay, so I think there's certainly a straw man here of like the role of families.
Okay.
Like this is a parent's decision, and like you're having the government raise our kids. That's a straw man. 2/3 of women with children under 6 are working. The vast majority of American parents have said they need a safe place to put their kids because they would prefer to earn income from their family. And that's one. Two, you know, it's kind of setting up this idea that the government is intervening in the family by providing free childcare or subsidizing childcare. But the government isn't intervening in the family, it's intervening in the market. The market is what's failing, the market is what's too expensive, and what government needs to do is rein in the negative effects of market failure. And so when people push back to me about like the government's raising our kids, I'm like, yeah, the government is not coming to my house at midnight when my son walks into my room and throws up on my packed luggage the night before we leave for Christmas vacation, right? Government's not there because the government's not raising my kids. And I kind of push back further to say, when you sign a defense bill, you don't put stars on your sleeve and say you're a general. You fund space research. You don't walk around the Capitol in flight suits, but you do anything to help children and you claim to be their parent. I mean, it's an arrogance that I think no other sphere would tolerate. And so these are my kind of 3 classic points, or 3 points that I make about the government raising our kids. The second thing that comes up, and I think the actual problem, is that this is just expensive. Y'all, if it's expensive for families, it's expensive for states. And if it's expensive for states, this really does lie on the federal level. And, you'll get that pushback of don't have kids you can't afford. And it's a pretty ugly comment to say that children are a luxury item in the United States and only the very richest deserve to be parents, and that's how we value family in the United States. That if there is a market that is in failure, that is preventing people from realizing their family dreams, we're going to side with the market and you don't get to have kids. I think a lot of times these kind of like canned phrases, people don't actually follow to their logical conclusions. The conclusions being that if a market says you don't deserve children, that's what America thinks too. You don't deserve children. And so I just try to push back and bring everything back to the market, right? You're not intervening in the family, you're intervening in the markets, right? It's not that people can't afford children, it is that the market has distorted the cost of children in a way that affects all of us. And so I push back on those things. And then I think, yeah, it just comes down to, is this a good use of taxpayer dollars? And if it's a good, and that one is, I think, probably the easiest one of like, yeah, it helps family budgets. You'll have more workers and you'll have more babies. Those are two of the more workers and more babies are two of the most valuable things in a cold-hearted economist calculation of the economy, population growth and workers, like manna from heaven. So it's the bang for the buck is incredibly high. It's just coming up with the willpower to do the right thing. And like I said in the presentation, this is the only solution. It's only going to come from the public sector. So at some point, you just got to put those big boy pants on and do the right thing. But I don't actually say that to legislators. That's kind of how I would characterize it to y'all, that like, there's no other solution that you're competing against. It's just how long it's going to take you to help people.
Yeah, I mean, that is a great point. We don't really balk at the idea that we have to, as a society, fund education. And I wonder if the disconnect is just that we don't see birth to 5 as education. We see it as babysitting. And so part of the work we've been trying to do is, really helping to educate folks on the brain development. I know this is not your wheelhouse, but on the importance of the learning that happens from 0 to 5. And as you said, it is the wealthiest of parents who are able to access the kind of education spaces that are supporting the whole child, that are doing, and certainly I don't want to diminish. We have a lot of, we have centers that serve all kinds of kids that are doing all of that work in incredible ways. But you can't.
I'm sorry, someone just put into the chat, it's actually the big girl pants that are going to get this done.
Oh,
and
yeah.
I'm so sorry to interrupt by laughing, but
yeah. Yes, I'll give you claps to that. That's a good. So I guess what I was saying is that I'm not suggesting that centers that serve a variety of incomes are not high quality. That is absolutely true. If you are a higher income family, you can guarantee that your child has the kind of space that you want, the kind of learning that you want. And I loved your point of, if you reduce the standards, what you're really doing is reducing standards for lower income children. I think that's a very strong point. So, so really great. And also thank you to all of our legislators who are here and paying so much attention that you can make awesome comments like that. So there's another comment here that is asking about, and I believe this comment, it's a little bit long, so I'm not going to read it in full, but sort of suggesting that there be more of a pathway for high school students to enter the labor force. I mean, that is absolutely true. We are low on workers in the childcare workforce, but, and I guess this is my question from the economic side, if the pay looks miserable for your future earnings, why on earth would you go into this pathway? And I guess that's, I'm curious about, we didn't so much we talked about the economy on a whole, but on an individual family, I mean, we've talked about families can't afford it if it's more, we like the 7% number, which has been a federal recommendation. We like that number, but families can't afford it if it's more than X. But we've also not done a whole lot of talking about, this is a subsidized system already. It's subsidized by the people, mostly women, working in this workforce. They're the ones subsidizing it.
And they have higher
so what would it mean for them?
And they have higher program participation rates because of the low wages they earn. So like you're subsidizing them in you know, you're paying for this in multiple ways to have such low wages in such a vital sector. So the question was about, you know, there used to be child development centers at high schools, and you were staffed by high school students. What I would say is that that's a great idea that we know how to do better now. And the problem with high school students is that they can have high attrition out. And so while it is nice for training, centering a development center at a place where you do have high attrition out makes them to be unattractive. That, you know, you want to put your kids someplace where you know the teacher is going to be there for more than a year or two. And that it's kind of like almost like a guaranteed higher level of turnover. So it's better to just, you know, place the kids who are in high school, if you wanted to do this, into centers that are more established and kind of distribute them across centers rather than concentrate them. The other thing I'll say is that there has been a lot of movement to create apprenticeship programs for child development to put into basically to put into practice non-4-year college pathways for high earnings in the childcare sector. So this is like you have a high school degree, you go into work at a childcare center, and then for, you know, 1 to 2 years, you're part-time enrolled in a community college that is in a nationally registered apprenticeship. Some states have registered apprenticeships. There's a push for a national one. The only problem is that the wages are so low afterwards, the apprenticeship isn't worth it. And so we have this actually excellent model for taking the current childcare workforce, for taking the future childcare workforce, helping them develop the relevant skills, giving them the type of credentials that can help them earn on the higher wages. We just don't have the market ability to pay them more because it's a market failure. So one of the interventions, you know, states are, I would say about half of states are incredibly active in childcare. And some of them are going straight to the workforce. Some of them are going straight to the families with money, and other ones are going straight to providers. And they're kind of making these interventions on one level. So DC Pay Equity Fund, straight to workers. Massachusetts, straight to providers. Maryland's going to do a mix. And I think, you know, the approach has to be, you know, you've got to just chip away at this problem and go fully. But the type of investments we want to make in this workforce, we know how to do it. We have to have more pay on the back end. If you dissolved the childcare market, put it into a fully reimbursed system where they don't charge families, they charge the state can dictate higher wages. And that is where you will start to have this like blossoming of workforce development for childcare workers when the state is reimbursing at the pay that they deserve, as opposed to the market paying them so much beneath what they're worth.
I love that. And I assume then we expect there to be an impact on sort of the bigger economy. In that beautiful utopia you just imagined, I assume that there's an impact on the whole economy when that workforce is secure and stable.
Yes, and a lot of states have actually, this has been pretty popular. They're moving to give childcare workers basically first access to vouchers. So with the child care vouchers, basically go to child care workers first and then families second. A lot of states have done that. I mean, there's a trade-off to doing it, but it's a way to kind of take the federal dollars you already get and direct it back into the child care sector through the workforce.
Yep.
It's been very popular. I mean, there's trade-offs, but that's also something that some states have done to try and, you know, basically prop up this sector. You know, the other thing I'll point out is that y'all, like, it's 2025. In 10 years, this conversation is going to be so much harder. And so what the call I would make to legislators is, I don't think in one session you can wave a magic wand and fix all of this. But the longer you wait to do anything, the harder it is going to be, and the more families and workers will suffer in the meantime. What I would also say is, and this is me purely speculating, something is going to come on the federal level, because they can't avoid it much longer. The market is not stable. It's runaway price growth, the pressure to do something federally on childcare is growing. And you talked about the number of bills in the Connecticut legislature. There's just as many in the federal legislature. People want to make a movement on childcare. So the other way to think about this is Connecticut, you gotta, it's better to stay ready than get ready.
Yes.
If the federal government said we're thinking of having a fully endorsed childcare system, like, would you know what to do? You know, do you know how to do that? Like, I think these type of movements of like fixing your care before federal government dollars arrive is a way to make make the federal case and to be like most, I would say, most efficient when the federal dollars do come. And I'm an optimist. I'm pretty sure they're coming. I don't know when, probably not this session, but
Yeah.
but there's going to be big movements on childcare.
Listen, there's one comment here which I love, which is they want the American family to live the American dream, but how can we when we have to spend our life savings on childcare? I think that pretty much sums it up. And then, we've got 1 minute and one final question here, which is, do you have any suggestions other than sort of the legislative policy side of how to get businesses involved? Because there are some fears that childcare be linked to employment, like healthcare is, and that it then again becomes something that only some people get to access. Does that help businesses? Does that structure help businesses? Because it seems like it wouldn't, that if the government was doing it, that businesses would also benefit. I'm just kind of curious about how you see the connections there.
Oh, yeah. I mean, this is workers that you get to hire.
Yeah.
Right? Every kid in care is a parent in the workforce. And as a member of the business community, every kid in care is a parent that can work and a parent that's earning income to spend in the economy. So if there's two versions of the world, one in which 50,000 kids and their parents are not working or earning income, and one that they are, like, which one do you think you'll have more customers in business? You'll have more customers in business with more workers and more
Right.
people having money to spend. So I think to me it's not a difficult sell. I think the part that when I talk to business leaders, what I tell them is that their voice, for better or worse, matters so much more than mine.
Mm.
In a chamber of commerce telling a legislature, we don't have enough workers or enough customers, you need to invest in childcare, it'll matter more than anything I've ever said to anyone. And I think the business community knows that childcare affects them, but they are not vocal advocates. Like
Right.
they haven't been as good of allies as they need to be. And in a lot of cases where childcare has succeeded, especially on local ballot initiatives, it has been like a local chamber of commerce that has made a big difference of when they were like, the business
Yes.
community will benefit, that tends to go forward. And so I think that they have an incredible role to play in this conversation, when they take the responsibility of knowing that this does affect them, good and bad,
Mhm.
and that they can ask for help. Because paying for someone's childcare as an employer is virtually impossible. I mean, it's so expensive.
Yeah.
But they know that it benefits them, which is why some of them try to do it. So it's just, if you know that you'll benefit from this, you should you should tell someone.
Yes.
If
Yes.
you see something, say something.
Sure.
Businesses.
And we have had incredible support from our state's business community, but you're right, it sort of trickles down to the individual businesses having to understand it. So Kathryn, I promised you we'd be out by 10. Thank you so much for your time here this morning. Thank you to all of our lawmakers who are on today for your comments, for your questions, and for your attention to this as we move forward. Before you leave, please click resources and sign up for part 2, but we will send that out after the fact as well. Thank you so much and have a wonderful day, everyone.
Bye, y'all.
I'll keep this open for 1 minute so folks have a chance to click those links. Sure thing.